sometimes what we assume is aging may be a sign of one of the fastest growing cancers in India today.
40 वर्सां जाल्या उपरांत हो प्रोस्टेट जो आसता तो वाडपाक स्टार्ट जाता. दोतोराच्या फुड्यान सुद्दां लोक केन्ना येतात, केन्ना त्रास जाता तेन्ना, बरें आसता तेन्ना कोणाक दोतोराचो याद जायना. हाका आयज काल बरी वखदां आसा अवेलेबल आनी बरें वायट कितें दुयेंस जावचे पयलीं तें आमी डिटेक्ट करपाक जातात आनी ताजो बरेपैकी ट्रिटमेंट करपाक जाता.
Hello and welcome. I'm Heather and you're watching Prudent Media. Today's conversation is for every man who's ever said, I'm fine, hum baro asa. For every wife who's ever noticed her husband waking up multiple times at night to use the loo. For every son and daughter who've attributed these signs and symptoms to mere aging. Because sometimes what we assume is aging may be a sign of one of the fastest growing cancers in India today. Most don't realize it until it's advanced. Today we're talking about prostate cancer. Facts, not fear, about action, not anxiety, and about hope, because when detected early, it is definitely treatable. To do that, amche sangata asa Dr Elphiston Fernandes, consultant urologist at Wisdom Muti-Speciality Hospital, Panjim. Doctor, thank you so much for being here with us.
It's a pleasure.
Let's start with the very basic. Many men don't even know what the prostate is or what it does, where it is. Could you help enlighten us, please?
So, prostate is the male sex gland. So, prostate हो gland असता तो फकत दाल्यांक असता. मुताची पिशवी जी आसा ताच्या खाला तो असता आनी मुताची वाट तातूंतल्यान पास जाता. सो 40 वर्सां जाल्या उपरांत हो प्रोस्टेट सगळ्या दाल्यांचो वाडपाक लागता. पयलो तो असो भायल्यान वाडटा आनी मागीर स्लोली मुताच्या वाटेन वाडटा. आनी मुताच्या वाटेन जेन्ना तो वाडटा, ओके, तो मुताची वाट प्रेस करून मुताची सगळी लक्षणां सुरू जाता. मुताची स्पीड कमी जावप, मुतांक फोर्स घालचो पडप, मुतल्या उपरांत मूत उरलां दिसप, रातचें उठचें पडप, मुतल्या उपरांत सॅटिस्फॅक्शन ना जावप, ओके, ही तेजी लक्षणां आसता. आनी चडशे दादले तुमी सांगला ते भाशेन आपली एज वाडली, आपणाची पिराय जाली म्हणून हे सिम्पटम्स जे आसता ताका नजर अंदाज करतात आनी मागीर हे चड जावन ताजी खूब भाशेन कॉम्प्लिकेशन्सां जावपाक शकतात. प्रोस्टेट हेजें मेन फंक्शन जें आसा जें आमचें सीमन आसता ताजें वॉल्यूम वाडोवपाचें. सीमन कॉन्ट्रिब्युशन ऑफ द प्रोस्टेट इज द समायनल प्लाज्मा जें आमी म्हणटात. सो that is the main function. But एज जाल्या उपरांत आफ्टर द एज ऑफ 40, ओके, हे प्रोस्टेटांचे चेंजीस जाता, ताका लागून प्रोस्टेट सायजीन वाडटा आनी ही जी लक्षणां आसा ती ताका लागून जातात. 80 to 90% of the times these symptoms are not treated because the patient doesn't come to the doctor. The person doesn't think it's a problem. And 2 to 5% of these men may actually be harboring a cancer along with this just a simple enlargement. So हाका लागून हे सिम्पटम्स, हे जी लक्षणां आसा तेजेर कॉन्सन्ट्रेशन करप एकदम गरजेचें. ओके, आमी ताका नजर अंदाज करूंक फावना, कित्याक हाका आयज काल बरी वखदां आसा अवेलेबल आनी बरें वायट कितें दुयेंस जावचे पयलीं तें आमी डिटेक्ट करपाक जातात आनी ताजो बरेपैकी ट्रिटमेंट करपाक जाता.
Doctor, you just said, there is prostate enlargement and there is prostate cancer.
Correct.
Now, you know, it could just be a simple enlargement. Yes. Would a man need treatment even for an enlargement or only in the case of cancer? What I'm trying to say is,
yes,
you know, if it's just an enlargement, then why see a doctor?
Yes. So, usually, आमचे general trend among the whole humanity is त्रास जाता तेन्ना ताजो हल्लो काडप. तेच भाशेन दोतोराच्या फुड्यान सुद्दां लोक केन्ना येतात, केन्ना त्रास जाता तेन्ना, बरें आसता तेन्ना कोणाक दोतोराचो याद जायना. ताका लागून, ओके, आतां तुमी जशें म्हणलां प्रोस्टेट एनलार्जमेंट. सो जशें हांवें दाखयलां हांगा, ओके, हो जो प्रोस्टेट ग्लँड आसा तातूंत फायब्रो मस्क्युलर ग्लँड्युलर हायपरप्लाजिया म्हणजे प्रोस्टेटाचे जे टिश्यू आसा एज वाडल्या उपरांत सायजीन वाडटात आनी वाडटा तेन्ना भायल्यान वाडटा तेन्ना कांय लक्षणां ना, तेन्ना घोडी ट्रिटमेंटाची गरजूय ना, पेशंट डॉक्टरा फुड्यान पावना. पूण जेन्ना ते मुताचे वाटे भितरल्यान वाडटा आनी मुताची लक्षणां सुरू जाता आनी पेशंटाचें रुटीन जें आसा, डे टू डे लायफ जें आसा तें जेन्ना एफेक्ट जाता तेन्ना ताजो ट्रिटमेंट करप एकदम गरजेचें. कित्याक ते करिना जाल्यार, ओके, तेजी कॉम्प्लिकेशन जावपाक शकता. ओके, प्रोस्टेट वाडोन कॉम्प्लिकेशनां कसली जातात. एक म्हणटा ते मूत भितरल्यान उरून मुताचे पिशवेन मूत फ्लो जायना, ताका लागून मुताची इन्फेक्शनां परती जावपाक शकतात.
Okay.
मूत खाली जायना, ताका लागून पिशवेन मूत खडे जावपाक शकतात. मुताचो प्रेशर वाडटा, तो प्रेशर किडनीच्यान परतो येवन किडनी फेलियर जावपाक शकता. सो साद्या प्रॉस्टेट एनलार्जमेंटान जातून कॅन्सर ना, तातून सुद्दां मारेकार कॉम्प्लिकेशन जावपाक शकता. ताका लागून हो ट्रिटमेंट, अशी लक्षणां आसा त्या पेशंटांनी ट्रिटमेंट करप गरजेचें. आनी हाजो जेन्ना आमी ट्रिटमेंट कोत्ता, ह्याच पेशंटा मदल्यान कोणाक कॅन्सर आसा तो डिटेक्ट जाता. कित्याक केन्ना तो पेशंट डॉक्टराच्या फुड्यान पावता तेन्ना डॉक्टराक अदमासान कळटा की ह्या पेशंटाक कॅन्सराचें दुयेंसूय आसपाक शकता. आनी तेन्ना पेशंट तो डॉक्टराच्या फुड्यान आयलोच ना जाल्यार कॅन्सर डिटेक्ट जावपाचो प्रश्नूच ना. सो ताका लागून 90 to 95% पेशंटांक दुयेंसां फकत प्रॉस्टेट एनलार्जमेंटान आसता, इतलें कॉमन. आनी तातूंतल्या 2 to 5% लोकांक भितरल्यान कॅन्सर आसपाक शकता. आतां कॅन्सर जेन्ना जाता, कॅन्सर पयलो म्हणजे जस्ट सुरू जाला जावपाक, तेन्ना पेशंटाक कांयच कॅन्सरा संबंदीत लक्षणां नासता. पूण जेन्ना हो कॅन्सर स्प्रेड जावपाक लागता, हो मातसो प्रॉस्टेटान वाडटा, तेन्ना थोडी लक्षणां आसता. ही लक्षणां पेशंटान तर आयडेंटिफाय केली जाल्यार तो डॉक्टराच्या फुड्यान बेगी येवपाक शकता. आतां ही लक्षणां खंयची? आतां समज रुटीन पेशंट प्रॉस्टेट एनलार्जमेंटाचो पेशंट आसा, डॉक्टरा कडेन रेगुलर ट्रिटमेंट घेता. आतां हो ट्रिटमेंट चालू आसतना सडनली थोड्याच दिसा भितर 1-2 आठवड्या भितर तेजी लक्षणां पयलीं पेक्षा खूपच चड जाल्या. सेम लक्षणां आसपाक शकता, जशे युरीन पास करपाक त्रास जावपाचे, पूण लक्षणां 15 दिसां भितर खूपच चड वाडल्या पयलीं पेक्षा. मेडिसिन्स चालू आसतना लक्षणां वाडल्या. किंवा हालींच पेशंटाच्या मुतान रगत आयला, ब्लड येयला युरिनान. किंवा तेजो फाटीचो कणो, कमरेचें हाड खूपच फोडपाक लागला, खूपच दुखपाक लागला. नॉर्मल चलपी भोंवपी मनीस, एक्टीव मनीस, ताका हें जावन ते कडेन म्हणजे तेजे सिम्पटम्स चड जावन ताका नजो कशें जाता, पुरो दिसता, रुटीन आपलें काम करपाक. जेन्ना आमी शिटूर रावपाक जाय, कित्याक त्या टायमाचेर अशें जावपाक शकता की मेलिग्नंट ट्रान्सफॉर्मेशन ऑर प्रॉस्टेट कॅन्सर त्या बिनायन ट्युमरान येवन त्या पेशंटाक गिरासपाक शकता. आनी ते तर टायमार डिटेक्ट जाल्ले ना ह्या सिम्पटमा प्रमाणे जाल्यार तो स्प्रेड जावन मागीर ट्रिटमेंट ऑप्शन्स आमचे लागीं खूब कमी जाता.
Okay, I think what doctor is trying to say is if you have any sort of urinary problem, consult a urologist. It could be a prostate enlargement, a mere prostate enlargement. But if your urinary incontinence is, you have other problems along with that, like your back pain, like you said, then it's possible that could be a more serious problem. Is that correct?
Absolutely. I mean, it is. You said it so well, and it couldn't have been said better. It's just like if your bike is not working or a car is not working, you're just going to take it to the mechanic. You're not going to go on Google and AI and try to fix it yourself. True. It is the same thing with our health, especially in the recent trends, the way people are trying to treat their symptoms using the artificial intelligence. That's a very dangerous and alarming trend.
It's always been. Google tells you you're going to die no matter what you put into Google.
Exactly. So it works both. It works more on the psyche of the person, and it just doesn't. You just have to visit the doctor. The moment you have entered that door, you can be assured, that you are going to be diagnosed and treated as per how it's required for your case.
But doctor, I know you said that you have to just visit the doctor, but besides the fear of such a big word as cancer, besides that, there is a lot of stigma attached. There is a lot of denial that not only men, I mean even women, as humans, we all have that. Do you think this is what keeps you from seeing a doctor?
Probably yes. It is what I would say. It's more like a denial. See, if you see the trend in our country over the last 50 years, the life expectancy has increased considerably. We have quite a few people living in the 6th, 7th, 8th decade, even in the 9th decade.
Yes.
So as we live longer, the chance of you having illnesses also increases, and the chance of you having cancers also increases. And there are certain type of cancers that are associated with age. In fact, prostateचो जो कॅन्सर आसा तो एज रिलेटेड आसता. सो 80 वर्सां जाल्या उपरांत प्रॉस्टेट कॅन्सर जावपाचे चान्सीस 80% वाडटा. पूण खूब फावटी 80% टायम तो डिटेक्ट जायना. आनी जिवीतभर तो डिटेक्ट जायनासतना उरता आनी पेशंटाचें मरण आनी दुसऱ्या कित्या कारणाक लागून
Yes.
येता जशें हार्ट अटॅक येवन स्ट्रोक
Because of age.
Exactly. So, and at the same time, we have people like young people who are getting affected with different kind of cancers because of like the vast environmental changes we are seeing it all over the last few years. So. Just being in denial, okay, and saying that particular illness cannot happen to me, okay, is like stupidity, I would say. So if you have like any symptom, like, you know, it is always advisable to go to the doctor and get it tested. It might be as simple as a cough. It might be as simple as a change in the urinary habit. And if it is something grave, like, you know, blood in the urine, okay, or a blocked urine, okay, then there is no question, but you have to go to the doctor.
Yes.
Okay, finally, whatever is diagnosed, detected, okay, the treatment options that are available, okay, in today's era are so much better than what we had available many years ago. So
Okay.
we have almost complete cures to so many cancers now. Okay, so that should be the ray of hope. That should be the silver lining for people who have cancers.
Doctor, now I know you said that, you know, one of the many symptoms is frequent urination, especially at night. So is frequent urination always a cause for worry, or how many times, like, you know, suppose say a man wakes up twice a night, thrice a night, is that okay? How many times a night should be a cause for worry?
हो तुम्ही एक एकदम लायक सादो पूण एकदम म्हत्वाचो प्रश्न विचारला. आतां नॉर्मली खंयचोच मनीस रातचो उठूंक फावना. ओके, रातचे आमी न्हिदपाक जाय. ओके, 6 ते 7 वरां न्हिदपाक जाय. पूण एक फावटी उठप, ओके, आमचें आतां लायफस्टायल जी आसा, आमचें काम आसा, आमचे जेवणाचे हॅबिट्स आसा, त्या प्रमाणे एक फावटी रातचें उठप एक्सेप्टेबल आसता. पूण ताजेकीन तर मायज ताजेकीन चड फावटी आमी रातचें उठचें पडलें तें डेफिनेटली एबनॉर्मल. पूण आमचे ते हॅबिट्साचेरूय आसा. जशें हें केन्नाय आमी हो जो वॅल्यू आसा एका वयर खंयच्या मनशाक जो मनीस आपले नॉर्मल, ओके, बरे लायफस्टायलीन जियेता, टायमार रातचो न्हिदता, जेवणाक लेट करिना, रातची टी व्ही पळयना, रातची ड्रिंक मारिना, त्या पेशंटान तेका सुद्दां, ओके, 2-3 फावटी मुतोंक उठचें पडलें जाल्यार ह्या मनशान हें लक्षण इम्पॉर्टंट. आतां कोण समज ड्रिंक मारून न्हिदूंक वयता, ओके, दॅट मे बी बिकॉज ऑफ द अल्कोहॉल दॅट ही हॅज टेकन.
Yes.
So considering and negating all the other factors that can influence your waking up in the night, okay, if a person is like leaving his routine, okay, sleeping early, having his dinner early, not taking excessive fluids close to his sleep, and yet has to wake up in the night, then this symptom has to be addressed.
Okay, so basically what you're saying is if it is more than once a night, then you need to just go and see a doctor.
Just go and see a
yes,
doctor.
it could be
Yeah.
nothing.
It could be nothing. It could be, you can help that patient detect diabetes. Sometimes diabetes, the only symptom is waking up in the night. Early kidney failure, one of the symptoms is waking up in the night.
Okay.
So each symptoms have so many diagnoses. So leave it to the specialist to detect that for you. Your job is just to go and see the doctor.
Okay. Now, I know you spoke about alcohol, you spoke about lifestyle, you spoke about diet.
Yes.
Are there very specific risk factors that could cause something like prostate cancer before the age of 50, say, for example, or before the age of 40, like you said?
Yes. So the proven risk factors or predisposing factors प्रोस्टेटाच्या कॅन्सराक जो आसता, सपोज आमच्या फॅमिलीन जेनेटीक ताका आमी म्हणटा, ओके, त्या मनशाच्या बापायक वा ताच्या भावाक, ओके, कॅन्सर जाल्लो आसता प्रोस्टेटाचो, त्या मनशाचे चान्सीस प्रोस्टेट कॅन्सर जावपाचो खूब वाडटात. ओके, इट इज 10 times more. थोडे जीन म्युटेशन्स आसता, ओके, इफ इट ऑल इट इज टेस्टेड इज डिटेक्टेड. बट नाव, ओके, रिसेंटली, ओके, द थर्ड फॅक्टर विच इज इन्फ्लुएन्सिंग प्रोस्टेट कॅन्सर्स, अँड इट इज नॉट जस्ट प्रोस्टेट कॅन्सर्स, इट इज lot of other cancers, okay, is a syndrome called as metabolic syndrome. And metabolic syndrome is not a big hi-fi term. It is just lifestyle associated illnesses, okay, which we have invited upon us by the change in the lifestyle that that this generation has imbibed on.
So I'm thinking sedentary lifestyle is one of the biggest.
Sedentary lifestyle, the food habits like eating microprocessed foods.
Fast foods.
Okay, yeah. So that gets you subjected to obesity, to high cholesterol levels, okay, fatty liver, and all this, okay, encompasses what is called as metabolic syndrome, where there are a lot of hormonal changes occurring in the body. And because of this hormonal changes, it disturbs the hormonal balance in the body, and it's the beginning of many cancers. Prostate cancer, also a lot of researches are being done about that. Okay, it is also being proven slowly that metabolic syndrome can also influence the occurrence of prostate cancers. But proven is mainly genetic.
Okay.
Yeah.
So now basically, I think what you're trying to say is that for men with a family history of
Yes.
prostate cancer,
Yes.
they need to start screening. At what age do you recommend that men like this start screening?
Yeah. So if the family has had, if there has been a cancer in the family, the prostatic cancer, it is important to find out at what age the death of that person occurred, and whether the death of the person was because of the prostate cancer or it was because of something else. If a person had a prostate cancer but lived till the 8th or 9th decade and died of something else,
Okay.
in all probabilities that prostate cancer was not very virulent, was not very fast growing, compared to a person who died very early of the cancer itself.
Okay.
So in these people, it is better to start screening them like by the time they are like 25, 30, once every year. Otherwise, okay, in the family, at 40 is the acceptable age. And even otherwise, if there has been no prostate
History.
cancer in the family, तुमच्या फॅमिलीन जर prostate cancer ना जाल्यार सुद्धा 50 वर्सां जाल्या उपरांत, ओके, वर्साक एक पावटी वा 2 वर्सांनी एक पावटी तुम्ही तुमचो टेस्ट करून तुमकां हो कॅन्सर आसपाची संभावना आसा वो ना ते डिटेक्ट करपाक जाता. तुमी आयकलां आसतलें आयज काल खूब हॉस्पिटलांनी मास्टर हेल्थ चॅकअप्स म्हूण येता.
Yes.
ओके, इन्शुरन्स कंपनीज चड प्रमोट करिना, तर तांकां तेजो चड फायदो जायना.
Okay.
पूण मास्टर हेल्थ चॅकअप्स आमी आमच्या इन्शुरन्स प्लॅनान इन्क्लूड तर केले जाल्यार वर्साक एक पावटी हे सगळे टेस्ट, ओके, एक टेस्ट प्रोस्टेटाचो आसा, पूण तातूंत आनी खूब 100शे टेस्ट आसता.
Okay.
तातूंत असले भाशेची दुयेंसां आसा जाची लक्षणां कॉम्प्लिकेशनां जावचे पयलींच ही दुयेंसां आमकां डिटेक्ट करपाक मेळटा, ताचो करेक्ट प्रकारे ट्रिटमेंट करपाक मेळटा, आनी कॉम्प्लिकेशन्स, त्रास, कॅन्सर जावचे पयलीं, ओके, आमी तेचें प्रिवेंशन करपाक जाता, बिकॉज प्रिवेंशन इज ऑलवेज बेटर देन क्युअर.
True. Doctor, now family history Assam Munon, is it, that if I have a family history as a male, is it written in stone that I will suffer from cancer?
No. So the thing is, like, it is just because like your father, your brother is having a cancer of the prostate, okay, it is not 100% like that you are going to get a cancer. Your risk is definitely more, and for that reason you have to be on the correct follow-ups, you have to do the correct test, you have to meet the specialists, okay, and follow it up as and how it has been advised for you, because we have a lot of these mutations get skipped. The cancer genes doesn't go to every single person.
Okay.
It skips generations. So it's not like the end of the road for you. You definitely have, you may be skipped from it, but since it's there, you have to follow
always
up
better
the
to be aware.
protocol and the regime that has been followed for that particular thing.
There was one very important thing that you said, which is one of the biggest advantages of prostate cancer is that if it is detected early, it is completely curable.
Yes.
Now, at what age men should start thinking about screening? We've spoken about, but what exactly is this screening? Kine asta?
Okay. So स्क्रीनिंग टेस्ट जो आमचो मास्टर हेल्थ चॅकअपार आसता, एक PSA म्हूण टेस्ट आसता, प्रोस्टेट स्पेसिफीक एंटीजन, एक सादोसो ब्लड टेस्ट. दुसऱ्या ब्लड टेस्टा बरोबर जेन्ना आमी ब्लड काडटा तो टेस्ट आमी करपाक जाता. सो तो टेस्ट आमी पळोवन तेजेर एक अंदाज घालता की ह्या मनशाचो PSA लेवल सारको ना आनी तेका आनीक फुडें टेस्ट करपाची गरज आसा आनी तेका प्रोस्टेट कॅन्सर जावपाची संभावना आसा. थोडी दुसरी कंडिशन आसता जातून हो PSA वाडपाक शकता. सो जायते फावटी PSA वाडिल्लो पळोवन मातशें 0.01 or 0.1 वाडिल्लो पळोवन पेशंटाक खूब अशी भिरांत दिसपाक शकता एंड दे मायट गो इन अ नेगेटीव टोन. तर तशें जावपाची गरज ना. आनीक थोडी कंडिशनां आसता जातून हो PSA वाडपाक शकता, जशें तुमकां जर मुताचें इन्फेक्शन आसा जेन्ना हो टेस्ट केला जाल्यार त्या टायमाचेर वाडपाक शकता. कोणाच्या प्रोस्टेटाची सायज जर खूब वाडलेली आसा जाल्यार तांचो PSA लेवल मातसो हाय आसता. ओके, इफ somebody has recently ejaculated when the test is being done, at that time that can come falsely high, and these are all false highs. So whenever your PSA is done, or even when you all do the master health checkup, immediately see the physician. The physician will screen what is important among those tests. Okay, the interpretation has to be done by the doctor, not by your AI and not by yourself. Because if you try to interpret those tests yourself, then you will be just walking a dark tunnel.
So now you spoke about when your PSA is high, but there have also been cases when your PSA is completely normal.
Correct.
So does that mean that you don't have a cancer?
So that comes to the second part of the screening, is like once this person is having some symptoms of urination and PSA may be normal, he's referred to the urologist. The urologist does the physical examination of the prostate, which is called as the digital rectal examination, where the physical examination is done and you get a feel of the prostate, how the prostate is feeling. And if the prostate doesn't feel normal, if there are any hard lumps or bumps into the prostate, then that doctor knows that something is going wrong there. Then we have to go for the next level of test. And usually when we suspect a kind of a problem or a cancer that might be there in the prostate, we usually do the next test, which is the MRI of the prostate. And on that MRI, we get like a clue. There is a grading called as Pyrads grading, and we get a clue if there is any particular lesion, कितें असो suspicious area आसा prostate, ताका एक 1 to 5 वाचो स्कोर दिल्लो आसता. 4 आनी 5 चड करून कॅन्सर आसपाक शकता, 1-2 कॅन्सर नासता, आनी 3 हेवटेन तेवटेन जावपाक शकता. सो ते केल्या उपरांत गरज आसा जाल्यार मागीर आमी पेशंटाची बायोप्सी काडटा आनी टेस्टिंगेक धाडटा. गरज ना जाल्यार आमी ते पेशंटाक फॉलो अप करपाक लायता.
Okay, now let's talk treatment. You said something about how medicine has advanced today. We've got minimally invasive techniques. We've got robotic surgeries. But is surgery always an option, or are there other forms of treatment as well?
Yes. So for any cancers in the body, the best treatment is given when the cancer is confined to the organ.
Before it spreads.
Yeah, before it spreads. The moment the cancer goes outside the organ, then like the chances of cure decrease. The chance of you getting a complete cure decrease. And in the organ itself, there are so many things, like which part, whether it's right inside, whether it has invaded into the capsule. So a lot of things like are taken into account before we give the final treatment. So कॅन्सराचें दुयेंस तर प्रोस्टेटान भितर आसा, ओके, स्प्रेड जाल्लें ना भायल्यान, ओके, तेंचो PSA वॅल्यू खूब चड हाय ना, ओके, आनी एक न्युक्लियर स्कॅन आमी करता प्रोस्टेटा खातीर, तातूंत तर स्प्रेड जाल्लें ना, ओके, जाल्यार ह्या पेशंटाक 2-3 भाशेचे ऑप्शन्स आमी दिवपाक शकता. ओके, एक म्हणटा ती सर्जरी. पयलींच्या तेंपार सर्जरी जी आसली, ओके, ती खूब अशी मेजर सर्जरी ओपन जाताली, ओके, ताजे मोबिडिटी, ताजे कॉम्प्लिकेशन चान्सीस मातशे चड हाय आसताले. आयज वॉट हॅज रेवोल्युशनायज्ड द ट्रिटमेंट इन सर्जिकल ट्रिटमेंट इज रोबोटिक removal of the prostate, because the surgery per se is safe, blood loss is not there, the chance of complications like incontinence, erectile dysfunction after the surgery are reduced considerably. So, and it removes the tumor from the body. So there is nothing like, if there is a tumor, you have removed it from the body, there is no question of following up whether it is it's coming back again and things. So that is one of the best options. Okay, but we have other options available, like we have radiotherapy. We can give radiations from outside. We can insert radioactive needles into the prostate. Okay, these also are good treatments available. We have certain hormonal treatments available. These keep the tumors confined to the prostate, but they are not able to remove the tumor out completely from this thing. And in prostate cancer, even when the tumor has spread outside, there are certain forms of treatment available, okay, for this particular type of cancer, because this is a hormone dependent cancer. Okay, there are different types of cancer. Since it is hormone dependent, doing some hormonal manipulations can help you, like, to prevent spread of the cancer.
Doctor, last few questions.
Yes.
Now we've spoken about stigma, we've spoken about denial. What about things like, lack of awareness or perhaps access to health care? Do you think that between diagnosis and treatment, are these challenges?
Absolutely. I mean, I think you nailed it on the head here in our country, because 90% of the patients in our country do not have insurance facilities, and they don't have access. 60 to 70% of our population stays in the villages where the closest hospital is miles away. So they sometimes are not able to reach the hospital for emergencies like heart attack or a stroke or a bleeding or an accident. And these illnesses are happening over a period of time where the symptoms are not very profound. So I agree with you fully. I think the intervention of the government with regards to making the various health schemes available at the ground level, at the grassroots level, to the needy and the poor will help them to reach a place of access to healthcare, and from there on it can be taken by the health professionals. So the health professionals need the patients to reach them. Even if it is through a scheme where the healthcare professionals have to reach the patients, we are good with that. But there has to be systems in place.
Basically, what we need are more outreach programs.
Exactly, we have to have outreach programs and systems in place for that. And after on, we can exercise our expertise for whatever is required to be done.
True. One last question before we sign off: are there any practical things that men can do to reduce their risk of prostate cancer?
So it may not be very specific for prostate cancer, but there are definitely certain things that we can do generally to be healthy and keep ourselves away from lifestyle associated illnesses. The first and foremost is hydrate yourself well. दिसा कमी 2 ते 3 लिटर कमीच कमी आमचे liquid intake जावपाक जाय. Okay, cut down on eating lot of microprocessed foods, tinned foods, foods that contain a lot of preservatives, monosodium glutamate. There are so many of them. Okay, these are known carcinogens. They are known to cause cancers in the body. Increase the intake of vegetables and fruits in your diet. They have a natural antioxidants. They help to fight cancer cells. They help to prevent. Huge intake of red meats, has to be avoided. And we have to include some kind of a physical activity routine in our day-to-day life, like doing strength, and cardio training, because that is going to help to keep your cholesterols, your blood pressures, your sugars, your thyroids, and rest of the hormones in the body. The body functions like a unit. It just functions. It's like how your camera is there here. It's functioning. It's processing everything. It's not one separate thing. So you have to try to keep the body healthy as a whole to prevent illnesses. And cancer is one such illness. So that is the message that I would like to give people is, though we are talking about prostate cancer over here, prevention of these illnesses is almost on the same line. It has the same algorithm. Prevention is better than cure. Live healthy, eat healthy food, live a healthy lifestyle, and be stress-free. That's what I like to tell everybody today.
Thank you, doctor, so much.
Sure.
I think that was the most important part of the entire conversation today. So, Zagruti and Tapasni, these are the two things that you need to, be aware of. Prostate cancer does not have to be a silent killer. With early screening, with growing awareness, and timely treatment, not forgetting our advanced medical options like robotic surgery that we have available to us today, men can survive, they can recover and live full active lives, I think. Am I correct?
Yes, of course, yes, that's right.
So if you're a man over 50 or you have family history, get screened. If you love someone who is, start the conversation. Ask the question, take the test. This is Heather saying bye for today. Thank you so much for joining us. You're watching Prudent Media.